Good morning, everyone. My name is Simran Chaudhry, and I welcome you all on behalf of Voice of Healthcare to a fourth edition of Not Just a Dog, Honoring Hope in Healing, recognizing the caregivers to celebrate National Doctors' Day. And to celebrate this day, we have with us Dr. Aashish Chaudhry, an orthopedic surgeon, director and head of the Department of Orthopaedics and Joint Replacement at Aakash Healthcare, Dwarka. Welcome to our show, sir.
Thank you so much. Thank you.
Sir, congratulations on National Doctors' Day to you.
Thank you, Ji. Thank you so much. It's an annual event, and we always love to get pampered on the Doctor's Day, at least.
uh, we are, we have this gratitude to all our doctors every year, every single moment when we see a patient, getting recovered, the treatment they get. But this particular day, we celebrate and show our respect and gratitude to all our doctors. So this year, this is the fourth edition of Doc, which is an extraordinary celebration dedicated to showcasing the remarkable efforts of our doctors and expressing our heartfelt appreciation for their selfless service. So, Not Just a Dog campaign aims to celebrate doctors beyond their profession. Yes, we know how much of hard work, selfless, you guys are on their toes to treat your patients and stuff like this. But we want to know and highlight the person who is beyond that profession. So that's why this campaign name is Not Just a Dog.
Okay. Okay.
So
Quite
moving
a good
forward,
concept.
I would like to know what inspired you to pursue a career in medicine and how do you balance your personal and professional life?
Well, to begin with, when you have to take that critical decision of getting into medicine or some other specialty or field, I mean, you are hardly 14 or 16-year old, and I don't think anyone at that stage, is smart enough to, take that lifelong decision. Unlike today's, I see that today's breed is much different, but in our times, way back in 94, 96, when I was doing 10th and 12th, the only thing which get me focused on the medicine was that my keen interest in biology, zoology, and botany, where I was getting good marks in 10th and 12th, and also exploring and knowing more about human body was always exciting. So I was very attentive in those classes where they were teaching various systems of the human body, and that's how that was the initial step which got me attached to the medicine part. And then of course the parents always wanted that. So the one thing which I clearly remember, that my father used to tell me that I also prepared for pre-medical and I could not clear. So my dream you have to complete, you have to fulfill. That was another pressure from the father, but yeah, it was not forced upon me. I was also inclined, and of course, it was serving both the purposes. So that's how I started preparing, and luckily, I got cleared in the first attempt. And the second part, professional and personal life balance. I think it's very difficult to achieve in healthcare space, especially if you are, you are in surgical field where it's an uphill task to, once you first you clear the MBBS, then you prepare for your surgical specialty, another exam, then you start your with a lot of hard work. You even if you get it, that's a 3 years long course, and wherein I clearly remember the first 2 months of my post graduation. We were only two people in the department, and we had to manage all 24 hours for 2 months. So I was coming on Monday, going back on Tuesday night. I was coming back on Wednesday morning, going back on Thursday night. So 36 hours non-stop for 2 months. And sometimes the other gets sick. I have to cover all nights together, and breakfast, lunch, dinner, everything was replaced. 90% were replaced by just the Bisleri bottle. And I clearly remember I lost 7 kgs in 3 months. That was the pressure when you join as a first year postgraduate. And then, as you rise up the ladder, Then comes the struggle to become a better surgeon, because surgical skill is an art. It doesn't, you don't learn it from the books. And I can very clearly say that from 2004, when the first time I started learning surgical part, and 2011, I would say, that was the first time I was doing independent procedure. And from that point till now, even today, it's every day, every surgery is a learning experience. So you never stop learning in this field. You keep improving yourself for the interest of the patient. So with this kind of pressure, it's difficult to maintain the personal and professional. I think there's nothing called professional personal balance in our space. It's just that it's always skewed towards your profession because you are too much inclined in the patient service. But yeah, the first few years were tougher, but now things are getting settling. They are settling down 10 to 15 years down the lane, and one is able to have at least 60-40 ratio, if not more.
Said it right. So, in this profession, it is very difficult to achieve that personal and professional balance. But somehow, whatever little bit I get to know from doctors and stuff, whether it's a 1 hour of break or any minute duration of break, that relieves itself a doctor, because breaks that break gives a lot of relaxation to doctor in between their working hours.
So for me, I'm chronically sleep deprived. So if I'm sitting somewhere and somebody doesn't talk to me for 5 minutes, I sleep. So I take every possible opportunity to sleep. And when I saw that Three Idiots movie where he was sleeping for 7 minutes, I think that's very true for us, at least for me. I can get that entire power nap and get refreshed in 7 minutes. That's what medicine has taught us.
So that's why we know how much of hard work is behind the success or every patient that recovers, doctor has done to to achieve that, to make that patient uh, be able to be normal, treated perfectly. So thank you so much for that, sir. So
Thank
any what I would like to know, any movie, book or music album. I know that you get a very little bit of time, but if you have read any book, watched any movie or song that had made a significant impact on you, and why?
So, movie, if you talk about, there was one movie by Tom Hanks, Castaway, a very old movie, where he was a FedEx employee, and the plane crashes and he gets lost alone on a deserted island, and he struggles to get back to the normal life but nobody was coming there, so I think he stayed there on that island alone for 14 years. And those 14 years, the struggle was to survive. And one day he actually came back to life onto the normal this thing. So that movie had a lot of lessons to learn. In fact, one of my MBA class, this movie was taught as a management lesson. How do we survive the crisis? How do we manage to sail through the difficult times? So I always quote the example of Castaway because it is very inspiring for one man to survive such hardships. And ultimately one that it's always said that if you continue to try, ultimately success comes to you. So that's a classical example. So that movie holds great place in form of a lot of respect for that character. And if you talk about books, not into too many reading, but yeah, I love books on solving mysteries and all. So there was one, of course, the first book which every medical student reads is The Doctors, where the life of the doctor is displayed in a very lucid manner. Then there's a famous surgeon from US. He wrote a book called Surgical Checklist. So that's for the surgeons, where how you learn from your mistakes, how you take care of patient, how do you manage the complications. So something or the other related to your own specialty, that is something which I like. And if you talk about songs, it's always, after a long, hard, struggling day of surgery, it's always, so my day always starts in the OT with the first surgery, with the Hanuman Chalisa, and usually ending by either Jagjit Singh or some old songs by Mohammad Rafi. So we are very old classical uh, song lovers, not into too much, because today's music is very short-lived. It's not,
Yeah.
I would say, Sadabahar, and we are happy, listening to the music of our times or our father's time.
Agreed, sir. So the music of that era has the capacity to hold whoever is listening to it. So that
Even
music
today.
holds you, whether you are into you're disgusted, you're upset at something, and that brings you back to the moment, and you start enjoying the lyrics.
Yes, they used to mean something, unlike today.
Correct. Agreed, sir.
Yeah.
So, like, you spend a lot of time in OT, you're treating your patients, doing surgeries and stuff. I want to know, what do you enjoy the most about interacting with your patients on a personal level, and how does this enhance your medical practice?
Well, so building onto surgical practice or your medical practice doesn't just mean that you give a good medicine or you do a fantastic surgery and that's about it. People will start loving you. No, it's much more beyond that. Many a times, I have seen patients who were doing doctor shopping. They came to me as the fourth or fifth consult, and they were thinking of doing the surgery. Until now, they could not decide. And the moment they talked to me, the next day they agreed to undergo the knife. So I realized over a period of time that it's the connect you make with your patients. It's not your degrees or professional qualifications which matters to them. What matters most is, for an elderly woman who is already scared of a procedure, how comforting the doctor is, how concerned he or she is for the illness. It's not just one case number for the clinician. It is a human being who has got emotions, who has got fears, who has got concerns regarding her or his health, and how well I am able to address those things rather than just somebody walking in and we are just looking at the papers, MRI reports, and just advising the treatment. So there's a fantastic article in a Harvard Business Review on the power of touch by a physician. So the physician doctor patient relationship, where somehow with the advent of technology and so many apps and telemedicine coming into play, uh, I feel the patients are still old school. They want to spend time with the doctor, unlike the COVID time, which was a forced teleconsult era. But now patients, they don't like doctors who just look at the screen and keep typing what they are saying. They don't like the doctors who just reach the diagnosis within 30 seconds and then prescribe surgery to them. So that's something which is still not liked by any clinician, any patient. And I feel that once in a while, sometimes I'm too busy. Many times I forget to examine in detail, or I am not able to touch the involved area. Patients stop me and tell me that you have not touched me. Please check my back, check my knee, so that I am pretty sure that what you are prescribing is right. So the power of touch is so important. Even today, it's relevant. It was relevant 100 years ago. It is relevant today also. So that connect has to be built before giving any treatment. And I have felt some patient who is already positive, whose confidence you have gained, I think they fare better in treatment outcomes also. Somebody who is the relationship has started with mistrust, they are also doubting the kind of treatment. They don't continue the treatment for long, and the results or the outcomes are also poor. So somehow these factors play a major role in my practice, and I feel more than what I am doing inside the OR. It's the initial, the first consult, the first impression is the last impression. How I deal with the patient, how I tell them about, how I give them options. And if you try and involve patient in every treatment decision, I think they feel a part of it and they feel more confident.
That's rightly said, sir. The connect needs to be there. That relationship which a doctor and patients have, that builds the trust, and that's how you, like you said, sometimes patients are not able to decide whether they want to go for the surgery or not. But if after talking to you, they get this idea. Okay, next day they're ready for the surgery. So that's the connection. That's the trust they get from this conversation that you
So,
build with your patients.
very simple example. So, like many patients, okay, today you have met me for the first time. If there is unfortunate, your loved ones want some kind of treatment, you go walk into any clinician, even my clinic. Even if you have heard good about a clinician, but if you don't like that first consultation, if you don't connect with the clinician, because it's a long journey, it's not just one episodic
Yes.
interaction you're going to have. If it is for your mother or father or somebody in your family who's loved ones, you would want the best for them. So unless you, as a decision maker, is not convinced with the doctor's confidence, because a lot of things come into play. In fact, 10 years ago, you say it's fortunate or unfortunate, but when I started my practice, of course, I was 10, 12 years younger as of now. That time I used to, explain everything to the patient. They were very convinced, but at the end they would ask who is going to operate. So if I say I will operate, they used to get shocked, sir. Don't mind, but how many surgeries you have done? You look too young to be a surgeon. So those kind of things also used to come. But so there's so many factors which come into play. Of course, in today's time, a lot of people are waking up. They are accepting younger surgeons because they feel they are more informed. They know the technology better. So that mindset is gradually changing among the community. White hair or bald hair, bald doctor is always better than a young surgeon. So those concepts are gradually fading away. But yeah, I saw this phase as well. But it's just the connect. In fact, many a times the patients have said, "Sir, you are too young. I know, but I am going to Medanta to get operated. But I must tell you that you are the one who convinced me. You gave me confidence. Of course, I'm going to get operated by a senior surgeon. But yeah, so you were the one who could make my mother positive about the treatment. So even that is, I feel, is an achievement where you are able to be the helping in the right decision making. So this is something which I feel goes beyond medicine and surgery. Your communication, your availability, and your compassion, what you show when you interact with patient or their attendants.
Very rightly said, sir. Like you quoted the example ki if someone in my family would require that, so a decision maker should be first convinced, and then he can convince the person or the patient to come to the
Of
doctor,
course.
or to take that person to that particular doctor for the treatment. But
Yes.
yes, that communication skills, that relation, that connect, that availability for the patient matters a lot. And if doctor is able to achieve that, then I think half of the work is done. Then the
Yeah.
diagnosis, medications, and surgeries are left.
Yes. That's why not every, so out of a box of 100 surgeons, I would say 90 would have the same surgical skill, but only two are popular
Hmm.
to get the maximum
Correct.
number of footfalls. So that footfall is not dependent, and they may not be from the best of the colleges. They may not have battery of list of qualifications, but those two doctors out of 100, they get the maximum confidence of the patient, and then the word of mouth spreads like anything. So it all depends on, it's much beyond your surgical skills. It's something more.
Yes, sir. It's very rightly said. So, congratulations again on National Doctors Day, and thank you so much for putting so much of hard work into your profession, and being available, being there for the patients, and putting them that trust, that thing that you guys, the patients are in safe hands if the doctors are there for you, and doctors are always there for the patients. And thank you so much for your selfless service for the society. Thanks a lot, and thank you so much for taking out time out of the busy
Thank you.
schedule and coming for this show.
Thank you. Thank you so much.